We're going to do a comparison between osteoporosis and osteoarthritis. Osteoporosis is a bone disorder characterized by decreased bone strength as a result of reduced bone quantity and quality. A person with osteoporosis has an increased risk of breaking a bone easily. Osteoarthritis is the most common form of arthritis. It is a degenerative joint disease that involves thinning or destruction of the smooth cartilage that covers the ends of bones, as well as changes to the bone underlying the joint cartilage. Osteoarthritis produces pain, stiffness, and reduced movement of the affected joint. And now we're going to talk about the difference in the symptoms of osteoporosis and osteoarthritis. Osteoporosis is called the silent thief because it can progress without symptoms until a broken bone occurs. When bones become severely weakened by osteoporosis, simple movements can lead to broken bones. Hip, spine, and wrist fractures are the most common fractures associated with osteoporosis. Osteoarthritis most often affects the hips, knees, fingers, feet, or spine. It affects each joint differently, and symptoms are easy to overlook, and it can be very painful. And now the diagnosis. Osteoporosis is diagnosed through a bone mineral density test, a simple, painless test that measures the amount of bone in the spine and hip. Meanwhile, osteoarthritis is diagnosed based on medical history, physical examination, and x-rays of the affected joints. And now we're going to compare between the risk factors of each disease. The risk of osteoporosis may be reduced by becoming aware of these risk factors and taking action to slow down the bone loss. Low bone mineral density is a major risk factor for fracture, the main consequence of osteoporosis. Other key risk factors include older age, prior low trauma fracture, a history of falls, and use of certain medications, such as corticosteroids. Family history of a fragility fracture is often a contributing factor. Factors that can contribute to the development of osteoarthritis include family history, physical inactivity, excess weight, and overuse or injury of joints. And now the appropriate treatments for each disease. Osteoporosis can be treated with lifestyle changes and often the use of prescription medication. Paying attention to diet, adequate calcium and vitamin D intake, and getting regular physical activity are important lifestyle changes. Weight-bearing and strength training exercises can help to manage pain and improve the strength of bones and muscles, which helps to prevent falls. Broken hips caused by osteoporosis usually need to be repaired surgically. Osteoarthritis, on the other hand, can be managed with the use of joint protection, which is decreasing the amount of work the joint has to do. Exercise, pain relief medication, heat and cold treatments, and weight control. Severe arthritis may be treated with an operation where damaged joints are replaced with an artificial implant. Knee and hip joint replacements are commonly performed. And if you have both diseases, then you should seek help planning a program to manage both conditions and pay special attention to advice about exercise. Regular weight-bearing exercise is usually recommended for individuals with osteoporosis, but may be difficult to follow in the presence of significant hip or knee arthritis. Keeping joints mobile requires a special approach to exercise and movement. Especially trained physiotherapists can help ensure exercises are safe and beneficial for both conditions. Thank you so much for watching, and stay tuned for more videos. And for more information, check out our Instagram. The link's in the description.